All right, last panel of the day. Is everybody ready? All right. So it is my pleasure. I'm Robin Shapiro. I'm the board chair and co-founder of Health Advocate X, and very delighted to present today this panel, which is a little bit different than what is described in the agenda. So, because we can swing with it, right? We're flexible. So I'm happy to introduce two interorganizational collaborative projects. One is the Health Advocacy Ethics Task Force, and one is the Coalition of Healthcare Advocacy Organizations. So although these are separate projects, and it's very important to remember that, there are exciting new ways that organizations and your membership organizations are working together for the benefit of advocates and patients. And so you're going to hear a little bit about that, and I know we have heard throughout the conference, why are there so many organizations? What do these organizations do? Can we be simplifying this? So this is a session that's going to describe in part at least the start of that, I think. And I would like to introduce the panel to you. So Dr. Stacy Baptista is representing NAC for Carey Kempton, who is not able to be here. Leo Christo is with Assumption and PAC-B Board. Beth Droppert is representing Health Advocate X. Brad Schwartz is representing Greater National Advocates. Danielle Marshall is not up there, although I have you on my list, and she'll be able to answer any questions from down there, I assume. And last but not least is Rachel Westlake, who is the interorganizational consultant and leader of this collaborative. So take it away.
Thank you, Robin. This is on. So thank you. Yes, we are very happy to share with you today the progress that has been made between healthcare advocacy organizations on behalf of practicing advocates to improve coordination in our community. After discussion at the last ICOPA conference, let's just say we heard you, and today's discussion will highlight our progress on behalf of advocates and the profession of healthcare advocacy as a whole. So part one, to begin our collaborative efforts, in 2021, the NAC Board of Directors agreed to review and update the Code of Ethics, which was first written in 2011 by NAC in the profession, for the profession of healthcare advocacy. In conversation with other leaders in the profession, in particular the Patient Advocacy Certification Board and Health Advocate X, it was felt that a combined effort with two members from each organization would produce the best document to serve patient healthcare advocates in the dynamic landscape of the profession of healthcare advocacy. And to that end, a joint task force was created, the Healthcare Advocacy Collaborative Task Force, and it contained 6 members. From NAC, we brought Ann Jacoby, who ensured that both the science and the art of practicing healthcare advocacy was represented. Carey Kempton also served. From Health Advocate X was Beth Droppert, who served on the original panel that developed the first Code of Ethics. Lisa Berry Blackstock also represented Health Advocate X. And from PAC-B, we had Leah Christo, Heidi Coomer, and Danielle Marshall, without whom the document would not have been released, so many thanks. This group has developed the revised Code of Ethics for Patient and Healthcare Advocates 2022, which I'm very pleased to say was released last Thursday. Now, Leah Christo.
Well, that's a good start for describing our process. Several of us came together to really savor the fine work that each of the organizations have done in terms of being inspired by the original Code of Ethics that was also informed by Ken Schuler's work. And we wanted to validate and respect how each organization has always maintained a commitment to ethics and trying to formulate and standardize best practices. And because as the job role changes, as we just heard about in the first hour for the job task analysis, similarly, what we need to do is revisit our ethical guidelines and update them for the dynamic context that we live in. We want to always honor the values inherent in practicing and working ethically, but we do need to occasionally revisit the content thereof and attend to, and so that we can respond to the kinds of needs that are before us, including, technology, diversity, equity, inclusion, and belonging, really attending to, post-pandemic realities. And so the members from these 3 organizations, inspired by lots of work that preceded us, came together because we recognized that each organization was looking to do their own work. And we figured, again, the theme of the conference, we're stronger, we're better together, we're stronger together. We started to think out loud. And that was a great personal and professional privilege to do so with such fine colleagues, and to do so from an interdisciplinary perspective as well as an interorganizational perspective, and to have the chance to really quite literally compare and contrast every word, sentence, paragraph of each of the respective ethical statements that the organizations adhered to, and to really begin to notice and highlight and prioritize and celebrate those common features that remain clearly the substance of the document that you'll be able to read online shortly, if not already. And so, that was the first order of business that we were able to do. We then, in the wake of such productive, collaborative, informal efforts on this common task to revisit the ethics document, we sort of said, hey, we can work well together, and let's do that, and let's see what that could look like. And so that led us into some other ways in which we wanted to think about doing that formally.
Yes, and I was since I was involved, like many in the room, with the first NAC Code of Ethics and developing standards and best practices, I was the gray hair that was able to be the thread through all of these, because I also worked with PEC-B when they adopt their Code of Ethics, and so now this revision is just another version, but we did really look hard and long at current practices and tried to really update the code to fit in with what's going on currently. So let me see what else I have here. What we're hoping is that all of the organizations and all of you advocates will review and adopt the code so that we're all practicing as one voice in one field. So we're very excited to release that. It took us a long time and a lot of work, and thanks to Danielle for being, she deserves an award. Anyway, so now we're going to switch to a different topic. There have been many discussions at conferences and events, and I'm sure even yesterday and today, about how our organizations can be more collaborative and really be coming together as a profession, a true profession. And we know the desire that you guys have expressed. We've heard it in lots of networking. And just like everyone else said, we heard you. And we decided to do something about it. And so because of the success we had just working with 3 organizations, we decided to move further. And we've been fortunate to have a facilitator who's been really financially supported by GNA initially. That's changed now that there's more of us involved. But we have someone who's brought us along, and we are seeing that we are truly better together, and we have made a lot of progress. We are now CHCAO. So, We are,
from
we
Chicago.
are, actually it's Chacos, and we were all going to wear them, but we kind of forgot. But
We all have our preferences.
it's the Coalition of Healthcare Advocacy Organizations, so it's CHCAO, so you can pronounce it however you want. But I wanted to introduce Rachel Westlake, who you've seen here, but you might not know about Rachel, so I'm going to just tell you about Rachel. Rachel is a board-certified patient advocate and an independent health advocate and organizational consultant. As a health advocate, she works with young adults who've had a cancer diagnosis, usually post-active treatment, and young adults with chronic illness. She serves her clients with a focus on building their self-advocacy skills and helping them create healthy teams that buttress them holistically. As an organizational consultant, which is our experience with Rachel, and facilitator of our coalition, she works to build intentional teams for the ultimate benefit of advocates and patients. Her facilitation and design techniques focus on slow process inquiry for enduring success, joy, curiosity, transparency, and inclusion. So we want to introduce Rachel, but Rachel's going to talk more about the coalition, and then we're going to take questions. I have to be on an 11:20 shuttle, so if I bolt out of here, you can email me. All right. Oh, you have one.
I do. Thanks. Hi, everybody. How are you doing? Are you good? Are you fried? Do you need to wiggle? Okay, good. My initial team building actually comes from teaching North Carolina kids team building skills and teachers. So we did a lot of ropes courses, wiggling around and sitting in circles before I started working with adults. So feel free, as I often do when people are talking, to move your body. We are health advocates. You've done a lot to get here, and it's always okay to take care of yourself. If that feels good to you, move about. But I'll be quick. So like Beth said, I came into this position because all of these folks have been working together for a really long time and wanted to work together more formally. I'm super grateful for Brad and our initial conversations. We worked together for a couple of months before this even got going, and Brad's been a wonderful friend, a great supporter, and he saw my skills and really helped bring me to the coalition to me, and us to evolve. So thanks so much, Brad. I also want to acknowledge Sophie, who's been walking around and passing out one-sheets that share a little bit of our mission and name and some of the committees and the purpose statements of all of those committees. Sophie works with GNA. She is fantastic. She provides tech support for a lot of the meetings so that I can focus on facilitation. And she also is often my sounding board when we go through slow process work, which is long and slow. And so she is incredibly patient, and I appreciate you very much, Sophie.
Thank you so much.
So we come together, at first we came together in a series of 4 interorganizational meetings where we were doing some general inquiry. We were doing a lot of opening and closing and narrowing to talk about what we could do better together. Eventually we decided to form a coalition. These folks had options. They are very busy, volunteers upon volunteers upon volunteers who spend, 6 hours at this point, a week at least, just probably managing my emails. I know, it's true. And so they could have chosen just to work on projects together for your sake, as advocates for your patients indirectly. But they chose to do something a little bit more formal and form a coalition, which is brave and takes tons of time. So I'm so grateful to be a part of this, and everyone's just wonderful to work with, and it's been so fun. So one of the adages that I work with is slow is smooth and smooth is fast. So even though this is an old, I think, sailors, so it goes with our theme, sailors and craftspeople, if you build something slowly with intention, and if you move slowly and purposefully, it works well and it lasts long. So that's the slow is smooth and smooth is fast. Those are sustainable decisions and ways to move forward. So we work with those values. And transparency, inclusion, all kinds of great stuff is put intentionally into the way that we work together. Yeah, do we have slides? We do have slides.
You can use your imagination. We'll try.
I need a one sheet then.
So
Do you have an extra thing that you passed out? No? You can tell it's the end of the conference.
because we had slides that had what organizations were involved and who else had contributed, so we need to
Start with that. Yeah.
There we go.
Okay. I also want to acknowledge, now that I'm seeing the full of my notes, one more person who's been particularly helpful, Danielle Marshall, again, of PAC Board. There has been a lot that I don't know, and Danielle helps fill in a lot of those blanks. She's also another sounding board for me when I have process questions, relationship building questions, and Beth, too, is always there to help me herd the cats, as many of them say. They acknowledge themselves as cats sometimes. So, participating member organizations of the Coalition of Healthcare Advocacy Organizations include the Alliance of Professional Health Advocates, Greater National Advocates, Health Advocate X, the National Association of Healthcare Advocacy, the Patient Advocate Certification Board, and Pulse Center for Patient Safety Education and Advocacy. Eileen Karina is not here, but Karen Isaacs of her board is here, and we're so glad that Pulse joins us with their patient safety mission. Mm-hmm. And we also had really great and important input from Ann Llewellyn and Karen Curtis of the Care Partner Project. So, thanks to all of you. So the mission of CHCAO, and some people like to think about it like Chaco, but I hope most of you have seen Ferris Bueller's Day Off. Okay, so do you know the song at the beginning by, what's it, Yellow with no W? Yeah, the 80s band Yellow with no W. It's Oh Yeah. They're like, bam, bam, chicka chicka.
Yeah.
Oh yeah. So I like that. It makes me smile every time I think about the coalition. And we do want to incorporate joy, and you know, we do heavy work, so joy is important as we build together. So the mission is to provide collaborative leadership that advances the profession of patient and healthcare advocacy for the sake of advocates and clients and patients. Pretty simple, but quite a feat if we can do it. It's made up of 4 committees, and I'm going to let some of those committee members share the purpose statement, so I cannot talk for a second. We'll start with messaging and nomenclature. Lee.
Well, these are the working names that we have of these committees. Whether they stay the names, I don't know, but basically they were the shorthand way of trying to capture some of the agenda items for the organization, the coalition, to start to organize around. And what we wanted to do was really work on synthesizing how do we start to speak with a common voice? You know, how do we represent with some inclusion? I don't want to say just uniformity, but real inclusion of all of the kinds of work that we do and the audiences that we're trying to reach. How do we formulate doing that mechanically, like with common calendars and things like this? What is that going to look like? So our hope is, as far as we've gotten so far, is just to sort of frame what the agenda items are. I don't even have subtasks to really describe for you, but wanting this audience to appreciate that we have this working framework that we're now going to start to populate. And so that would be the order of business for at least the first committee. That be fair?
Sure.
Would,
Were you talking?
am I operations as well?
No, just messaging,
Messaging and
nomenclature.
nomenclature.
Yeah, that was messaging. Okay. So messaging and nomenclature is one organization.
Yeah, I can talk about that. The committee that, well, I'm actually on a lot of committees, but the central space is really, we decided to, there's a lot of things we could do, but we decided to prioritize having a calendar where we could post all of the organization's events so that they're not, you know, NAC's not having a networking and then we go ahead and do a community conversation. We are going to have a calendar, and this is a trial, so it's not out yet, but we're trying it for a period of time as a pilot, and then we hope that that will also someday have a place for shared resources and lots of other shared things. But it's very exciting. Tricia already had that model set up, and so we're using a pretty simple calendar idea, and we're going to work on that for several months and get back to the committee with how's that going. And it will prevent overlap and hopefully get more of us to each other's events, because right now we don't know where everybody's events are and when they are. So it's very exciting. Let's see, measurement. Is that Carey?
I was going to do, I'll do measurement. Oh, I'll have two
Oh, there you go.
microphones.
Yeah.
Yeah, okay. So measurement answers, hopefully, will answer some of the questions around data and ways to analyze the data on the profession that's been previously collected by the organization. So the first order of business is to gather what's already there and then find the gaps and see where we can go. We need measurement on the profession, measurement on outcomes, and how patient advocates support patients and improve success of outcomes. And then operations. Stacey, you want to? I'll do operations. It's Saturday. So the operations committee, there's no executive committee. That should be shared. This is a consensus-based, again, you know, we make decisions slowly, it's tricky, and everybody comes to the table and is welcome at all of the committees. So there's no current executive committee as we've formed. But the operations committee does undertake how we're going to move forward structurally and support the other committees and sort of the strategic planning end of the coalition. So that's it. We wanted to, you know, just celebrate that this is happening. It's a pretty big deal. It's a long time coming. I know there's been many successful endeavors in the past. I'm excited to be a part of this one. Brad, do you want to add anything?
Of course.
I'm just glad to be sitting at a table, all being friendly with all these other organizations, and that's the whole purpose of it for a while. I think we were all well-intentioned, talking the talk, but not necessarily to each other. So shared calendar is a great start. I think the most important thing about what we're doing right now is the fact that we're all at the table. We're all talking to each other. We're going to try not to overlap. We're going to do what we can to hopefully focus on our individual strengths as organizations. As we preach to individual advocates, we have to lead by example. So when it comes to collaboration, and you guys have been sitting through a 2-day conference here that's all talk about sharing and getting together, it doesn't mean anything unless we're doing it from the top down. So that's the point of what we're doing. Just to give you an idea, I mean, we meet, we talk, we discuss, and it's led by Rachel. She deserves a standing ovation because this is not an easy venture.
Okay, yeah. So let's end on that celebratory note. We're very excited. It's Beth's birthday. It's the birth of what?
We have some
It's the birth of CHCAO.
Questions? Oh, right.
Yeah, there's some questions.
Sure. We'd love to hear your hopes and dreams. And questions,
Is the
yes.
shared calendar going to be public, or is it just for the organizations?
Thank you.
So right now, like I said, we're piloting it. We're literally, the committee is piloting it. It's not even for the whole coalition yet. If it works, if we think that it's a good idea, we will probably demo it publicly and do that for a while to make sure that it's operable. We may have to have, we think, a website, a joint website eventually. And so this calendar might not be the be-all end-all, but it's a great place to start. So we'll keep you posted.
Yeah, a little context. Only a couple months under our belt.
Yeah.
So,
Go ahead, Michelle.
Website. There's not a website right now. There's maybe discussion to have that website. Okay.
There is a discussion.
Okay.
As you can imagine, this is a huge endeavor. Not just time is money, but money. You know, thank God for Rachel, but Rachel needs to eat and, you know, drive her car. So, you know, all of the organizations have contributed. We didn't go to anyone, all you guys asked, but going forward, there's going to be things that we're going to have to fund, we collectively, and we'll, once the coalition is organized and we get to the next, we're on baby steps, we'll for sure try to develop a website and have more, you know, have more input. We really would love to have more input, but right now it's enough for us to take
Right.
these baby steps.
So my other question is, obviously, there's always going to be a cost. Membership. Is there going to be like a membership to be a part of CHCAO?
So at this point, we're on an MOU, and when we revisit that MOU, the
Memorandum of
sorry.
Understanding.
It's like the 8th time, Anne, you've slapped my hand about that. Sorry. So when we revisit our next stage, there may be an opportunity for admissions, but again, it's a organizational representative group. So for now, it's not for independent advocates. It is for organizations that support advocates.
So is there room for other organizations to join CHCAO?
Yes, we hope so. And when it is time to reopen after we finish our May baby step, we're going to let everybody know.
Okay, perfect. Last question. For that calendar, which I think is a fantastic idea, is there like a lead time? You know, give us your 6-month calendar, give us a year calendar, like there's going to be a deadline to get that calendar out.
Yeah, so right now, we're going to do this pilot for a few months. The MOU ends at the end of May. So we're on a pretty strict timeline. The calendar doesn't have to end at the end of May, but what we intend to do is evaluate, does that calendar make the most sense? Like, are there links in there that get you to a place where you get CEs? I mean, there's all kinds of questions we need to ask. When we go out, if it works, and when we go out to all advocates or, you know, other organizations, we will have to look at that. Like, what kind of time frame? Who's posting it? Who's managing it? What if something gets taken down? What, you know, so there's a lot of administrative questions around that. Right now, we're just sharing, basically.
Perfect. Thank
Yeah.
you.
Yeah.
I would just say that those are the kind of operational questions that we're just starting to formulate ourselves in this committee. We are literally building this runway to take off in real time. So these are really great questions, and we don't have formulated, adopted answers yet, but we have commitment to working through some of these important questions.
Fantastic.
And we may
Thank you.
come back to you and ask for your help.
I'm available. Shh, did I say that? CHCAO.
I just want to offer my congratulations and my gratitude to you for doing this. I was a founding member of NAC Joanna Smith founded it. We had our first meeting in Berkeley in 2009. Is anyone in this room who was in Berkeley in 2009? A few of us diehards. Anyway, I went on to become vice president, president, education committee, secretary of NAC, everything for, I don't know, 6 or 7 years. And my greatest desire was to collaborate between organizations, especially with Tricia's organization, and there were just institutional obstacles in the way, and I couldn't get it done as much as I realized, and so many of us did, that the way to go forward was to grow together. So thank you for making this a reality. I'm just grateful. Thank you.
Yeah, I can feel your joy, because those of us who were at that first, we had no idea where this was going. And to see the numbers, to be here today and see this is just phenomenal. And we know there's a lot of people who couldn't be here, and they're still part of this family. And so we're gonna just keep this going.
I'm sorry, I didn't hear Michelle's question about fees. But what was the question specific? For the coalition, so that you would have access to all organizations? Okay, so I wanted to ask about a Disneyland pass where, I'm currently paying for 4 organizations, and I'm wondering if there's any way to get a pass to be active, and also to throw some money Brad's way, because I don't think he collects any fees. Is that right?
Well, you should talk to Brad after. I'm sure he would be happy to.
No, but I am a member of 4, I'm a paying member of 4 organizations, so I'm just asking whether that would be a practical thing for us members to enjoy.
That's a smart idea.
That's a good idea. That's interesting.
And thank you. And also on the topic of international, we have an international conference here, but there have not been a single that I know of, that I remember, that I was paying attention to, topic that was truly international. We have a few people from overseas. During the year, throughout all of the good educational activities we enjoy with the various organizations, I also have failed to see any real references to international stuff. I'm a sort of an international guy. I was an exchange student in Belgium a long time ago. I went back to visit my family a few years ago, and they said even in Belgium, where everything's paid for in the healthcare system, this would be a great thing. It's a rich country. I can't believe they wouldn't have paid patient advocates, but I have no idea. I have no idea what they do, whether Americans could learn from what they do. We're a very large and insular country in many ways, and we don't look out of ourselves for references very often. I would like to learn what is being done in the rest of the world, and I'm just wondering if any of the organizations have intentions to kind of develop those kinds of activities or educational opportunities.
I'm going to take that one.
Yeah, I think, go ahead. Trish.
Sorry.
Okay.
Should I answer the question, or?
Well, I'll answer it partially, and you finish it up, okay?
Sure.
Okay, so ICOPA, yes, International Conference. And Scott, this is a great question. And I'm sure Ayman, who's sitting over here, and Amani, who's sitting over here somewhere too, are international visitors. So yes, that's what the intention has been. But as many of you know, international has often represented the United States and Canada. And then we started getting questions. We were on the PAC board, seriously, when I was still on before 2018, asking about international versions of the exam. And we had people from Israel, England, we've had a number of people from other countries who've taken it. In 2018, we didn't have any attendees from other countries, although we had people here from Canada. In 2020, when we intended to have ICOPA again, what we found was that Anne, in particular, gets all the credit for reaching out to all those people we knew internationally. And what did we have, like 20 people that we knew of around the country, from Japan, from Israel, from India, from France, yes, all over, Australia, England. And we got videos, and we've actually asked you all to go to the website. We have links to they're 2 and 3 minute vignettes talking about advocacy in their countries. And those have been our attempts. This year, and again, specifically reached out to all the people we knew internationally who were doing advocacy, but they couldn't travel. The pandemic precluded all of that travel. And more wanted to be here and wrote to us, and we stayed in touch with them. It just could not happen. Please know that there are international initiatives underway, but right now it's a tough sell in the middle of a pandemic. But we'll make it happen. Wouldn't it be fun, too, that we could hold this in Tuscany or something like that and all go there? So it goes two ways. And yes, it's a great question. This is just a tough time for that. Your turn, Brett.
Great. So these things move slow, but I want to start out by saying that the overriding principle here is for us to, I believe, focus on what we're good at. And we already know that there's a vast majority of this country that is underserved, and I get the whole Belgium thing. But I also know, and here's where the confidence comes in, that patient safety is on the radar. The government doesn't use the word advocacy so much, but for the first time in a long time, the United States has reactivated a program under the World Health Organization that is in the process right now of conversations with the Secretary of Health and Human Services about developing a patient safety agency as part of the federal government to monitor patient safety and collect all of these things. I'm a member of a group called Patients for Patient Safety, which is founded by some, I don't know, anybody know Marty Hatley and Dave Mayer, the doctors, and they've been working at this for a long time, and they weren't getting any traction, but with the new administration, they got the heads up that they should start this thing up again. They got all these contacts. So I believe, given what's going on with patient safety, and I've always been a believer that there's really not much of a difference between patient safety and patient advocacy. We're advocating for patient safety. I'd like to follow their lead and tag on and jump into those projects as much as we can, and I can guarantee you with the collaborative spirit that we have here, as soon as I know what's going on in that regard, you guys will all be the first ones to know. But right now it's a growing group, and it's really focused on patients because they want to hear the stories of the individual patients, and patients might be what move the legislation and the awareness and the international component of it. And that's where we're at. So.
Hello, I'm Carolyn Bennett, and I represent an advocate in low to middle income countries. It's through most of these countries, all of them that I know of, they all have socialized medicine, but we go in and we do cleft lip and cleft palate repair to the kids who fall through their cracks. And so we spend a lot of time advocating safety, quality measures, around the world. We have 30 cleft centers, and next week I'm leaving for Madagascar. So we take care of being the advocate to the low, middle income countries of the world, and that is part of my advocacy.
Absolutely.
That's great. We can
That's-
use you in West Virginia too. You know?
Yeah.
That's awesome. So I think that we just could talk forever about so many different things. I'm gonna wrap up the coalition piece and so that we can get off the stage, because I want that badly. And say thank you so much. Thanks for hearing about the coalition. If you have more questions and ideas, bring them to your member organizations so that those representatives can come and bring that to the coalition, and we can better represent you. Thanks so much.